fact, researchers confirm that the women who keep their breasts after having a mastectomy tend to do better mentally and physically. So the notion that once they get a diagnosis, once they get feel a lump and they think it could be breast cancer, then the next thought is, I'm losing my breast. That's not true anymore. Also, the notion that all my lymph glands will be removed. As long as we diagnose the cancer early, there's a good chance.
Hi everyone, welcome to another episode of Moments with Nyengeterai. I'm so excited to have you back with us, and thank you for this community. It's growing stronger every day. Thank you for the comments, thank you for the advice, thank you for everything that you've been asking us, the people that you want us to bring, the subjects that you want us to touch on. I'm really excited about the engagement that's in the community now. So before we start, please could you go and like, subscribe, and share this podcast and just help this community grow. And again, I just want to say thank you. So today, as you know, we are in the month of October and it's Breast Cancer Awareness Month. And a lot of you have actually asked us to bring in specialists or people, doctors who can talk about breast cancer. So today, I actually have some phenomenal guests who I'll be talking to in regards to breast cancer. So without further ado, Dr. Nyakabau, welcome.
Hi, Nyenge.
Dr. Simba, how are you?
Hi, Nyenge. Thank you very much for the invitation.
Thank you for coming. Thank you for taking time out of your busy schedule. So just to get people excited and to know that you really are specialists and I just didn't bring any people from the street, can you just give us just a brief overview of who you are, Dr. Nyakabau and Dr. Simba, just the same thing as well, just briefly.
Oh, thank you very much, Nyenge. Thank you for inviting me. I'm a clinical oncologist, which means a doctor who looks after cancer patients. But I not only look after cancer patients, I want to actually be able to talk to them and engage them so that they can understand this disease and know what to do so that they don't come to me for treatment.
Okay, that's a very interesting perspective. Dr. Simba?
Yes, Nyenge, thank you very much, and a big hi to your viewers. I am Simbarashe Mungazi. I'm a breast surgeon. Basically, I deal with breast problems. I was trained as a surgeon, but I now just do only breast work. And largely, most of my patients are breast cancer patients.
Okay. All right. Fantastic. So we're going to start there being Breast Cancer Awareness Month. Although I think we should talk about cancer every single day, and every single month, I know that October is specifically for breast cancer. So today we're going to talk a lot about breast cancer. So I'll start with you, Simba. When it comes to breast cancer, I mean, what should people look out for? Or is there a diet that people should eat to avoid getting breast cancer? Because I think there's just a lot of stories around breast cancer. Let's start there.
All right. Thank you very much for the question. So with breast cancer, the symptoms, quite a number, but basically most patients, they actually notice a lump on their breast or swelling. And usually these lumps are painless. In other words, there's no pain at all. And because of that, there's actually this, comfort that I don't need to see a doctor. I don't need to go to a health facility because the lump is painless. It's only when it's painful that people get worried. Whilst in fact, they actually should be worried when it's painless. The other symptoms are skin changes. If there's redness of the skin, if they what we call puckering or pulling in of the skin.
Where about? By the breast?
On the breast.
Okay.
Yes, the skin over covering the breast. The nipple changes that happen, like pulling in of the nipple or a rash on the nipple that's not healing, nipple discharge, and any subtle change in the breast, it should be checked.
Okay.
in a nutshell. Yeah, I'm not sure if Dr. Nyakabau wants to add on.
Yes.
Oh, thank you very much, Nyenge. Once again, when it comes to, cancer, first and foremost, I think it's important for people to really understand what cancer is about. Normally our bodies are made up of cells, and these cells grow, and then they stop growing, most of them, because they don't have to be providing anything. So when you get an abnormality whereby the cells have changed or transformed, when cells were not supposed to grow, all of a sudden they are now growing, and they grow to produce abnormal cells that have the capacity to either outgrow other cells that are normal, and then also the capacity to spread to other parts of the body. Then that kind of cell is a malignant cell. And the process takes a long, long time, maybe over 10 years, such that a lot of people can actually be going around doing their business, not knowing that they could be harboring cancer cells. And this is why we say this is a subject that should be of interest to everyone, because really and truly, you never know when it is going to be your chance, or you are the one who is having it. So yes, that's what cancer is all about, and we need all to start thinking about it, doing something about it before we get it. And then back to the symptoms. In terms of cancer, what is important is that we need to know ourselves. When we know our bodies, when you have got cancer, we are now having a change in part of your body. So if you know your body, you can then be able to tell all those changes that doctor is talking about. And before that, you could even also have tests done that can actually see this cancer before it has developed, or before it is showing up, what they call screening of the cancer. There are special tests that have been shown to actually reduce the risk of someone dying of breast cancer. A test called a mammography, an X-ray of the breast, which is done on older women whose breasts are no longer as dense as younger women, such that they can actually compress them and take a picture of the breast, and then they will be able to see abnormalities. Maybe one day when you have got an opportunity, you can actually show those yours what a mammography looks like. So this person will not be having any lumps or any symptoms at all, but because they have got a higher risk of breast cancer, or maybe at an age where the risk is higher, because age is another risk factor.
What's the age? When you talk about age, so there are two questions I just want to unpack from what you've both discussed. First of all, the lump issue. Because, how do I know this lump is... And I think I'm now talking from just a general person, or I am just a general person. Because sometimes as I'm bathing and I'm feeling my body, and I just think, this doesn't feel like a lump, or is it a lump, or is it not a lump? How do I know which lump should be alarming? That's number one. Two, and we talked about pre-screening. What age do people start pre-screening, for going for mammographs and things like that? I know now that I'm older, like 51, I literally only started, I think, in my late 40s, going for those annual checkups every year. In fact, I have my mammogram every 2 years now. But how, and it's only because I was talking to people, I have access to people who know. What about people who don't have access to you, and they're just maybe watching? When can they start going for those things, and how do they even feel for the lump? Yeah.
Very good question, Nyenge. Thank you so much. Well, the first most important thing to mention is that whenever one is unsure, they should go to their doctor and check. So we cannot describe for you what kind of lump that is suspicious of cancer. I think that's the doctor's role. But the message is whenever one feels a change in that breast, that may not necessarily have to be well equipped to actually pick up a lump, but if they do pick up a lump, just feels like swelling lump, you will never know what it is until you see a doctor. So my conclusion to that is that whenever one is sure, they should see a doctor. They should never think that, well, I think there's a lump. Well, I think that there's no lump. Once you get to that situation, just go see a doctor. In terms of screening, we do have a lot of different guidelines for different countries. I'm not aware of our local guidelines in terms of screening, but generally we look at the age of 40 and above for women to having breast cancer screening, which is what my colleague Nyakabau mentioned in mammography. The other countries, I know that in the UK they do them once in 3 years. In the US, I think it's a different scenario. Some of them recommend yearly. So it's a bit of a mixed bag in there in terms of the frequency or on how and when to do the I don't know what about this.
Yeah, thank you very much, Nyenge. I think it's also important to realize that I talked about self-awareness, whereby every woman, and maybe even to a certain extent every man, should know their breasts in terms of appearance. You should not be scared of or ashamed of looking at yourself in the mirror and looking at your breasts and getting used to them, because obviously there are some people who have got indrawn nipples from a young age, and thank God, we have got symmetry. You can compare the two sides. If they are indrawn and it's not a change, it's not something that you should worry about. And then if the nipples were not indrawn and there is this sudden change in one nipple being indrawn, then it's kind of like a telltale sign that there could be something wrong. And in that case, it's important to make sure that one presents oneself to the healthcare workers so that you can then be checked out. And it's also important to actually let your viewers or listeners know that, knowing where to go first is very important. We do have people who may go to, say, alternative practitioners who may not be very familiar with some of these things, and they get treated, thinking they're getting treated. Depending on what is wrong with them, sometimes it may actually delay people with cancer. So it's important to know which site to seek information from, even on the internet. It's important to know where to go first. In fact, I like the song, "The First Cut is the deepest." It means the first time is the best time. So if you go to the right place, you are more likely to get the right treatment, and the outcomes are more likely to be much better than if you maybe go in a roundabout way, eventually coming to the right place where you can get the appropriate treatment.
Okay. All right, that's very interesting. So to me, I'm just listening to both of you talking. I'm thinking, here I am. I'm just a normal human being who's never had any background on medicine, let's say, and I've been presented with this. I've got maybe a small lump that I'm feeling like, oh, it could be cancer, maybe it could be not. I haven't gone for a mammogram because I'm thinking, do I really need one? And maybe I'm just so scared about the word cancer. Can we demystify, can you kind of like demystify breast cancer and how many people actually survive? Because I think right now when I think cancer, I just think death. When I hear the word cancer, I just think the next thing is I'm going to die. So I want you to just demystify why it's important to have treatment and what the kind of treatment that goes on and what to expect and the different stages that people go through.
If I may start, thank you. Thanks, Nyenge, for that good question. So the World Health Organization statistics actually confirm that the cases of breast cancer are actually highest in the Western world. As we speak, 1 in 8, 1 in 7 women in the UK do get breast cancer in their lifetime.
In Zim?
In Zim, the statistics are actually way lower than compared to the Western world. However, the same WHO statistics confirm that more of the African population actually die from breast cancer, as compared to the Western population where it's plenty.
Why is that? It's because people are not presenting.
There are multiple issues, factors that are contributing to this poor outcome in our population in Africa. Number one is what Dr. Nyakabau mentioned, screening. Number two, health consciousness. Our population may not be that health conscious as compared to the Western population. And if they do find any symptoms, our population in Africa, they tend to try with alternative medicine. Hence, they actually present late. And when, as Dr. Nyakabau was mentioning earlier on about cancer, these cells that become abnormal and then they start spreading the rest of the body. So we do know that when breast cancer starts in the breast, if it's caught at that point and treated, the outcome is very good. And this is what the Western world has done. However, in Africa, Zimbabwe, is one of the unfortunate scenarios. Most of our patients, both male and female, come late.
Male? You said male?
Yeah, because male patients do get breast cancer as well.
I don't think a lot of men know that. Do men actually know that men can get breast cancer?
I hope they now know from this discussion. I have treated patients with breast cancer.
Male patients?
Male patients, yes. And there are multifactorial reasons also why patients, some present late, besides the fact that they will look sick for alternative, health practitioners. Some, lack of knowledge. We still emphasize that if you have a lump, it's seen, but some they still think, well, this lump is not cancer. Then this denial delays them presenting. And once they delay, it means the staging you're asking me about. So the staging. So what we know that breast cancer starts early stage, and then as it progresses, then it comes to stage 4. So half of our patients present with stage 4.
And stage 4 means what to a layman?
Stage 4, it means that now the cancer is advanced. It's now involving the other organs, the liver, the bone, the lungs. So the treatment pretty much can be given, but it can't be aimed for cure because of the stage.
Okay. Before we continue, I just want to unpack something that you talked about. Alternative medicine, let's go there. We are Africans. We are in Africa. We are in Zimbabwe. As doctors, what are the issues? Let me take that into you, Dr. Nya. What are the issues that you are being presented with? That's why you're saying some people present late because they're looking for alternative medicine, and maybe that's all they've known. What are the cases that you're seeing? What are the problems that are coming from that? And how can we tackle it?
Yeah, I think this is a topic that really needs research in our environment, as far as unpacking the reasons behind why our patients, most of them are presenting to the alternative practitioners. We call them the competition. Is it because of us who are not making sure that the patients prefer us? It's because are we not marketing ourselves enough with the work that we do, such that they prefer to come to us? So we really need to do some research. And unfortunately, a lot of those who bought the alternative practitioners, they end up coming to us with advanced stage disease. And I've had patients who actually regret. They kind of will be in a state where they say, I wish I had known. So my other question is that, in fact, before I actually asked that question, I went for a massage last weekend. And the lady who was doing the massage, I was telling them about the Breast Cancer Awareness Month. And then she asked me a question that, really? Do we have any patients in Zimbabwe who have cancer? She asked me this, I was taken aback. And then I said to myself, yeah, we've got a lot of work to do. If people even doubt that there are people with cancer in our own environment, it means they are not aware. So awareness needs to be spread like a bushfire. It's not that sometimes people are just not aware. They are not aware of what they can do to prevent the cancer. They are not aware of what they should do such that the cancer is detected if they develop it. They are not aware that for you to make a diagnosis of cancer, you actually need tissue to be taken so that it's examined by specialists to confirm the diagnosis. You go to a practitioner who tells you it's cancer, and nobody has ever taken any tissue to confirm the cancer. And then you say, I was cured of cancer, when it was never diagnosed in the first place. Maybe it's someone who just had maybe an infection, and they were treated with whatever they were treated with, and it healed. And then the other people who hear that, oh no, I was treated, I had this, and then I went and I got healed. They believe you. So maybe another thing that we need also is for our patients who have been successfully treated. There are some who come out and actually tell people that they are healed. As a practitioner, I can't go telling people that I treated so and so, treated so and so. In fact, I have patients. I've been in the profession since 1994. And I have patients. I can't even call them patients. I call them clients who come every year to see me just for a checkup, because obviously if someone has had cancer, you can also say there is a personal history of cancer, in the sense that sometimes you may develop even other cancers. So they go into the habit of coming back. It's actually recommended that they continue coming for reviews so that we continue checking on them, because we know that if we get the cancer when it's still early, we can cure it better. I equate that to a man who has just married a woman and they're beating them up. That woman is likely to run away faster than someone who has been married for 20, 30 years. They'll tell you, you are the one who is going to go away. So yeah, that's, that's how things are, when it comes to cancer. It's always nice to really go deep down and actually put this to the people so that they can really understand the perspective. When the disease is more advanced, there is likely to be more versions of the disease. That's like we started with Adam and Eve, they were related. And then we had children of their children and with their children, now unrelated. The same with cancer. If you start off with a few cells, they are more likely to be related, such that even simple treatment, one treatment is likely to cure you. When the disease has got roots in every direction, you are likely to get, cells that are completely unrelated, such that that's where you then, when the person gets treated, one part responds, the other part does not respond. And usually such a person needs many different types of treatments, and it costs much more. This is why people complain that, cancer treatment is
expensive.
Because they are coming when the disease is really advanced, established, settled, that it's an ongoing battle. The disease doesn't want to go away because it has had its comfort in your body. But when it's still early, it can run away very easily because it's still naive and unsettled. Better still, if you can actually learn preventive measures. There's that old adage that prevention is better than cure.
So, and actually, because I actually want to go the preventative, because I actually want to ask, is there any way that we can, obviously, like some cancer, like you said, is hereditary and everything, but is there any way that we can either prevent or maybe reduce chances of getting cancer, number one, and then number two, treatment? I want to go back to alternative medicine. Why I'm saying that? I'm saying it because I'm seeing a lot of this in these groups. you are putting there, they're like, alternative, here I am, wherever I've got this medicine, I can treat this and this and this and this, and cancer, always thrown in. And I think because now we're getting a lot of, maybe it's now that there's a bit more knowledge, we hear a lot of cancer, or maybe because now it's affecting, if it's not affecting you personally, like maybe with a relative or yourself, it's affecting a friend of some sort. So somehow we are now getting to hear more about cancer, unlike before. So because of that, and I think alternative, and someone says to me, I see it in a group. They are more like, and I'm telling you from a normal human being, they're more likely want to go to the inner group before they come to you. Number one. Number two, because there's so many theories about chemo. Once you start chemo, you are going to die. Those theories, I want you to demystify those things. So I want us to touch on those 3 areas, because these are the things that people are facing in real life. And these are the conversations people are having outside your medical circles. Us normal people are having this conversation. So I want us to tackle those 2 areas.
Do you mean we are not normal?
Wow. You guys talk about stems and cells, and we talk cancer, period.
Okay. Which one do you want me to start
So I don't know who wants to tackle which one.
Okay.
Yeah.
I mean, chemotherapy, I can start.
Okay, you can tackle chemo, then we'll tackle the other 2.
Okay, so
you doctors.
I mean, chemotherapy is a form of cancer treatment. It can be used either before an operation. I mean, first and foremost, the patient has to be diagnosed. And I mean, there are different chemotherapy regimes for different cancers. So it's not just one same disease, one same treatment. And this is one thing that also patients must remember, that patients for different diseases, they are different. And don't always compare what so-and-so is getting. So that you say, your doctor gave me this, and this one didn't get. Patients are individuals, and their diseases are also individuals in their own right, so they are treated differently.
So let's say someone presents with stage 1 breast cancer. How many chemotherapy rounds do you expect, and what can they expect? And someone presents with a stage 4. So if you give me those one, a stage 1 and a stage 4.
So, I mean, stage 0, they don't even, it's like almost 100% cure. When the tumor is still confined to the ducts, stage 1 disease, they may not even need chemotherapy. So we sit as groups of doctors to make decisions on who gets chemo. In fact, here in Zimbabwe, we actually have what you call breast multidisciplinary team, where doctors actually sit together. And Mr. Mungazi is one of the doctors. In fact, he's one of the steering people in terms of how should we treat individual patients. So patients don't even know that behind the scenes, we work on them so that...
As a team.
Yes.
Okay, so when I come and see Dr. Simba.
Yes.
When I leave, Dr. Simba is now talking with his colleagues.
Yes.
To say, okay.
Gone are the days when the good old doctor would make all the decisions.
Oh, that's very interesting.
Yeah,
that's
more heads are better than one. So sometimes you might have been blind to a certain area, and then your colleague will point out and say, have you considered this? And then you say, yes. And then we treat the patient nicely. So when the patient comes, they can see it's me. I look so wise because I've got the wisdom of all these colleagues fine working together with me. So back to chemotherapy. So with chemotherapy, it's one of the treatments.
Especially for breast cancer. Let's focus on breast cancer.
It's one of the treatments that we use for maybe it's breast cancer that is spread mostly to the lymph nodes or beyond. It's more curable for disease that is not metastatic. When we say not metastatic, it means it has not gone outside the confines of the region. Like, for example, it has not gone, say, to the bones or the liver or the lungs. Because when it is now metastatic, the chances of the cure are much less. So if you can cure, say, 90% for stage 1, for stage 4, you are going to be able to cure maybe less than 20-30%. So that's why we encourage people to come with early disease. And when it's stage 4, the chances of us needing ongoing treatment to keep suppressing the disease are much higher. And it means it's more costly for the patients because they now need ongoing treatment, like someone who has got high blood pressure, who is just getting this treatment and that, and it may appear as if, these doctors, maybe they want money, they keep treating the patient. No, it's because the disease is got multiple versions of itself, which may or may not respond to the treatment. So chemotherapy, we are hitting blindly. It kills multiplying cells, but it also kills the normal multiplying cells of the body. And commonly, the hair, people then always talk about the loss of hair, but also even the blood cells of the people. So, the blood cells that are vulnerable are the ones that multiply fast, like the white blood cells, the soldiers, and also the platelets, which are the ones that we use for clotting, and to a lesser extent, the red blood cells that we use for carrying oxygen. So this is why someone who is going to need chemotherapy has to have a check of their blood cells, because the chemotherapy is not selective. It hits everything that it gets to, that is multiplying. So we give it in pulses. That is, we give maybe once every 3 weeks, so that we allow the normal cells to recover. And then, fortunately, the normal cells recover faster than the cancer cells. Before the patient, the tumor cells start regrowing, we are ready to give the patient more chemotherapy. And therefore, that's why the patient will be saying, he's getting better, and before they are much better, they are hitting the patient again. So, and we give the treatments according to, in most cases, the weight and height of the patient. So it's also, the dose is individualized, such that, we have to work out your dose. And also you have to be well to receive chemotherapy. If the patient is unwell, we will not give, of course there are some chemotherapy regimens that are kinder than the other chemotherapy. So then that's where the selection of which one is the best regime for a particular patient comes in. And also depending, breast cancer again is not one disease. There are various variants of breast cancer. There are tests that are done. We call them molecular testing of the cancer. There are tumors that are fueled by even our own natural body estrogens, such that they grow. That's why there are treatments that we can use for actually targeting the cells that are stimulated by the estrogens. There are what you call receptors on the tumor, like keyhole, where the estrogen will go and attach to that and make the tumor actually grow. So there are medications like tamoxifen, which is one drug that, in fact, I want to say to the people that, as an organization that I'm part of, we managed to get patients to get that medication free of charge at the Public Institute of Protection. The tamoxifen attaches to the cell and actually blocks the estrogen from getting. So the tamoxifen will be competing with the estrogen, and it blocks the estrogen receptor, the estrogen receptor, such that the growth stimulation is actually stopped, and the tumor is actually stopped from growing. So patients can take tamoxifen for at least 5 to 10 years. This is after they've had their curative treatment by Mungazi, the surgery, and then other treatments like radiotherapy, which is X-ray treatment that you give to treat the roots of the cancer. So where the surgeon has removed and the risk of cancer is higher locally, and maybe the patient has had chemotherapy, we can give them tamoxifen and other anti-hormone treatments that we also can use to make sure we produce an environment that continuously suppresses the growth of cancer. So we are working on the law that, when you remove the cancer, you only remove what you see. But we have to cater for what we don't see. And this is why we have to use other treatments, be it the chemotherapy to remove what we don't see in the blood, the radiotherapy to remove what we don't see locally, the roots of the cancer. So there will be nothing, and it appears, are these people trying to joke with me? And then the hormone treatment, so that you continuously suppress any possibly remaining cells. And we actually say the patients who have got estrogen receptor positive tumors usually have a better prognosis because they also have a lot of other options of treatment. By the way, cancer treatment, there's a lot of research. When I started, the options were very limited. All we had was maybe just the surgery, the chemotherapy, and maybe just later on tamoxifen. And now there are many more options of treatment and more,
including the natural herbs that I want him to talk about. That I want you to address as well, because I really think we need to address that as we are closing off, to just say, what are the... I think it's an important... I don't know how you can tackle it from a medical side on the problem or the goodness of taking alternative medicine. I don't know. I want to hear from you why people should not take alternative, and what are the effects as well. And then obviously why, when someone has a mastectomy, what leads to that, and then maybe just close us off on just the Breast Cancer Awareness Month and what people should just look out for the rest of the month.
All right. So can I start with the second question? Is breast cancer diagnosis, is that it offering?
Oh.
Things evolve. We always used to traditionally offer a mastectomy where we remove the whole breast. We also remove the nodes in the armpit, the deep flanks. I must say now we've drastically changed in the way we treat breast cancer. As my colleague Nyakabau has mentioned, we are now doing individualized care. Patients present with early disease. There is an option of actually doing a lumpectomy, just removing the lump with healthy tissue around it, and the patient having radiotherapy to the breast. Studies have shown that the outcome is the same.
Wow.
As compared to a woman who gets a mastectomy. It's traditionally been done. In fact, research has confirmed that the women who keep their breasts after having a mastectomy tend to do better mentally and psychologically. So the notion that one gets, once they get a diagnosis, once they feel a lump and they think it's could be breast cancer, then the next thought is, I'm losing my breast. That's not true anymore. Also, the notion that all my lymph glands will be removed. As long as we diagnose the cancer early, there's a good chance that we can actually sample a few nodes in the armpit, and if there's no disease, then there's no need for the rest of the other nodes to be removed. So there's such a huge change.
Wow.
So that's in a nutshell. Also, for women who have to have a mastectomy, it's not necessarily that you have to get a mastectomy with a flat chest after the operation. There are options where we can offer you breast reconstruction after or immediately during the first operation. So these are all options that are available for women who have early breast cancer. The issue of alternative medicine, I have no experience with them. I'm aware that there are alternative health practitioners that offer these. There are few challenges with their approach. I can only speak of what I did. My colleague we believe in surgery, we believe in that, chemotherapy, radiotherapy. This is reproducible all over the world. And we have enough data, research that follows up what we do. I'm not sure whether we have enough data of patients who are having alternative medicine if they are being followed up, if their treatment is reproducible, if it's standard treatment across the world. It's funny enough that some patients who end up with alternative medicine would have started with the clinicians. So they feel a lump or they have a change, they present to themselves to a clinician. It is the clinician who does the necessary investigations that Dr. Nyakabau was talking about. Necessary tissue or samples are taken and submitted to a health professional who then look under a microscope and confirm that they indeed is cancer. After this diagnosis, then you find the public going to the alternative medicine. So they rely on the backbone of the science that we have. And then when things get bad, they still come back. If we had alternative medicine that could stand alone on itself, get the diagnosis of breast cancer in whatever way they can do it and then treat it, but I don't have the data that's available. What we practice is standard all over the world. It's reproducible. It's been confirmed by studies that it works. And we continually improve on our understanding of breast cancer and on our treatment. Just as my colleague mentioned that when she started, the different chemotherapeutic drugs are now totally, different from what she's having now to give her patients. So we constantly move, but I can't understand the rationale of alternative medicine because it only comes when a patient opts for it. But I've never seen any good outcomes of patients. What I have seen is patients who have had alternative medicine coming with stage 4 disease. That's confirmed.
Okay. Wow. Okay. I hope our listeners have heard out there. And as we close off the show, I just want you to give me, just to close off and to say it's Breast Cancer Awareness Month. What are people supposed to look out for? And not just this month only. I think it's something that should be done every other day, every other month. What should people be looking out for as a breast cancer specialist? What are we saying to the people this month and going forward?
What we are saying, number one, is don't wait for October. Know your body. So if there's such that if there's a change, you are aware of it. There's a simple way of doing what we call TLC. You touch your breasts, you look at them, and then you check them. And if there's any change, you get checked by your doctor.
Fantastic. That's a nice one. Dr. Nyakabau, briefly.
Thank you very much. I still want to say a bit about alternative medicine. I think my dream is that if we can come together with them so that we can learn from them what makes them get the patients, and then we can actually ride on each other to get the best outcomes together. If necessary, whatever they're using, we can actually do some research on it, compare with our medicine, and then see what is useful to the patients. I think that will take us forward in a better way because I believe rather than antagonizing them, let's embrace them as professionals and work with them so that we can help our patients better because somehow the patient will still go to them. And I think to win the battle, we have to have them with us. And if the policymakers could make sure that they enable that, I think it would be very useful for our people. And before I leave, I would like to say that cancer is a disease that can affect anyone of us. It's not a next-door disease, and that there is always something that can be done before prevention, screening and early detection, screening before symptoms develop, early detection when the tumor is still small, treatment, and in fact, we mustn't forget that even if you have got advanced disease, there is also what you call supportive and palliative care that can actually help people to live in spite of the disease. And sometimes people can live for years with advanced disease if they come and get help, such that their quality of life is good and we all in a happy world. And above all, let's all do something individually, as society, as a country, to close the cancer care gap.
Oh, thank you. That's a nice way to close. So I'd like to encourage everyone as we're going into the week, into the month, into the rest of the year. I think like Dr. Simba said, cancer is not just an October thing. We have to continuously TLC, touch, look, and check. Well, I thought it was tender loving care, but touch, look, and check. So let's not forget to have to be self-aware. Let's love looking at our body. Let's take care of our body. Let's not just wait. Let's make sure we touch, look, and make sure we check. Thank you, everyone. I'll see you next week.